Tonight in Your Health Matters, we learn about the role outpatient clinics play in rural northern Michigan.
With some patients having to drive 1 or 2 hours just to get to a major hospital, outpatient clinics are crucial. 7 and 4's Melissa Smith and photojournalist Bob Rhodes introduce us to one man who relies on a Gaylord clinic for his heart health.
For Ward Olson, staying physically active is a part of his daily lifestyle, and with a nickname like Coach, it only makes sense.
I ride my bike in, which takes about 15 minutes. I get set up at the stand. I do this 7 days a week, 6 hours a day for approximately 5 months.
Keep in mind, Olson, or Coach, is 82 years old. After coaching high school sports for more than 30 years, he now works at the Garland Lodge and Resort in Montmorency County.
I'm kind of the unofficial, official greeter. I say good morning, good afternoon, and good evening to everyone that comes from the lounge into the pro shop or comes from the parking lot into the pro shop.
It was while working here one day back in June that Olson started to have severe pain.
I was riding in on my bicycle, and I just didn't feel that well.
That's when Olson decided to go to his regular Munson outpatient clinic in Gaylord, not thinking anything was seriously wrong.
And while I was in the doctor's office, that pain came about. The doctor said, "We're going to take you over to Munson Hospital."
My husband was sitting on the table, the examining table, and he grabbed my arm and just dug in, and he said, "Oh my God, the pain in my arm is unbearable." And I looked at the doctor and I said, "He's having a heart attack right here." And so it was so fortunate they were hooked right to the hospital.
Dr. Tony Ochoa is a Munson cardiologist who works at the Gaylord Clinic every week. He was the one who sent Olson to Munson's ER in Traverse City.
He looked ill pretty much when he came up to the front desk and for check-in. So we immediately recognized, Ward could be having a heart attack. And
it was obviously a serious matter that required emergency care out of Munson Medical Center. But Dr. Ochoa says having outpatient clinics like the one in Gaylord can make a world of difference for patients like Olson.
If they're having problems, they need to get seen, and if they can get seen over there, closer to where they live, as opposed to waiting 2 weeks to get an appointment over here, it makes it much nicer.
They took me by ambulance over to Munson, which was an hour-and-a-half drive, and they made it much faster than that. And the people in the emergency vehicles were tremendous.
He's a very good patient in the sense that he's doing all the right things, but unfortunately still things happen. Munson is very dedicated in that regard in trying to maintain outpatient clinics, and they want us to go out as close to these smaller communities and see the patients in their natural setting, as you'll call it, to make it more comfortable for the patients.
In Montmorency and Grand Traverse counties, Melissa Smith, 7 and 4 News.
Now, Ward did end up having a 90% blockage in his heart, and that's what he was treated for. He says now he's doing just fine, and he continues to stay active, and he watches his diet.
If you'd like more information about outpatient clinics close to where you live, you can go to our website, UpNorthLive.com.